I went to Cornell undergrad. I went to NYU medical school. I took a gap year between those two, and then I started my residency at NYU, and then I left residency due to life circumstances for 10 years. And then I went back and I did the 3 years of internal medicine at Lincoln Hospital in the Bronx. I now have been about 4.5 years in a traditional practice, which means I have 3.5 days of outpatient internal medicine and a half a day of hospital time. I round in the hospital Saturdays and Sundays about once a month. And I'm a professor at Westchester at New York Medical College in Valhalla. I actually have two appointments, one in internal medicine and one in family medicine. I initially taught in internal medicine, but I was only getting a week or two with my students, and a lot asked for recommendations, and I wasn't so thrilled or didn't feel that I was getting them to tell them enough. So actually, when I switched to family medicine, I now have them rotate for 4 weeks. When I teach, I focus on a couple of really important things, no matter what they're going into, including rapport building, taking histories when a patient doesn't want to give you histories. We do some end of life because I do some palliative care in the hospital that I'm in. And that's it. So I'm super excited to be here, and I'm really here to answer anything you got.
Okay, awesome. So we'll take one question from the chat really quick, and then we'll go to raise hands. We had one already. If you know this, that's totally fine. If not, it's not a big deal. But do you know how the elimination of the step 2 CS and step 1 being pass fail will affect residency applications in the future?
So I actually do have oddly enough, have some insight into this. So let me just say, I actually did a post on getting rid of CS, and I am so thrilled about it. It was the stupidest, time-consuming, expensive test that wasn't good. So when I finished medical school, there wasn't 2 parts of CS. There was only one step 2. And when I went back 10 years later to take my step 3, they made me, while I was in residency, do this, it's called OSCEs, where it's clinical interactions with actors. You have to write a note in the specified time. You have to give differential diagnosis. It is just it was the most sort of artificial environment that was never going to be the way it was. You'll do a lot of OSCEs in med school, and there are definitely benefits. And one of the things it does is it standardizes all the teaching. In medical school, you also do shelf tests after each rotation, internal medicine, family medicine. Those are standardized across the country. But, again, the elimination of CS, I believe initially was, there was a language component. They wanted to know you could, speak English well enough, but the notes are totally artificial. The time limit on it was ridiculous. I think you should all be psyched that it's just one hoop that's out of your way. Going to medical school, it's just like an obstacle course. It is so worth it, in my opinion. I love my job, but my path wasn't straight. So you just do what you got to do. I think I answered that. Yeah.
Yeah. I mean.
Oh, I'm sorry. And then let me just say one other thing. Step 1, pass fail. It's tough. There's good and bad to that, right? There should be less pressure on it after your first 2 years, which the pass fail gives it. But if you're going for a really competitive specialty and do really well on the test, you don't get that benefit anymore. So, other things are going to have more meaning than that step 1 score. Your step 2 score may have more meaning. Your grades on rotations, your recommendations, and things like that.
Okay, great. And I feel like that's pretty what we've been hearing consistently, is that it just means other things will be more important in the long run. Okay, so that's awesome. So someone was asking, do you recommend working as, a pharmacy technician or a telescribe or anything like that right now when we have, limited options on what we can do, and also just for experience purposes?
Yes. So it's so hard to pick out of the air what you want to be when you grow up. Like, it's so much better to just do something. And it doesn't even have to be something so medical, but interacting with people is really good. So I got, after my last time I was with you guys, someone asked if I'd be their mentor. I said, absolutely. She's now volunteering at the vaccine clinic. She's not giving the vaccines, but she's welcoming the people. She said it gives her such a good feeling. Anything that gets you to figure out what you like about that is really good. And it could be the most random thing. Like, I know some of my students are, equestrians, and they volunteered with disabled people, teaching them to ride horse. Anything that gets your feet wet, gives you the ability to interact with tons of people. Like, even a retail job, you may not think it's medical, but that is the best training you can have, because people are going to come in mad, happy, right? Like, any interaction you can have is really good. You just, and you use the stuff that you do. I don't think there's any prescribed way. I don't think anyone's checking boxes. If I was interviewing someone for medical school or residency, I look for them to have passion about what they did. Like, my son's a 16-year-old, he's looking at colleges. Like, I see him trying to get this and that and this and that. And what I try to tell him is focus on something you're really interested in, because it'll be more meaningful. The depth of what you give is better. So, I think that's important, and being able to verbalize, that stuff is really important.
Yeah, definitely. I agree. And thank you for that. This is more like going forward. When should we even think about fellowship? If we want to do that later in life, should we plan ahead now, or just kind of figure it out as we, dip our toes in? And then also, like, if we wanted to, how would we know what kind of fellowship residency we want to look to?
So I absolutely went in thinking I'd be a pediatrician. My gap year, I worked for a woman at Sloan who was a gynecologist for cancer patients specifically. She's like, literally, Lisa, you don't want to be a pediatrician, you want to be a mother. I don't think you're a pediatrician material. She was 100% right. And that was one of my mentors that really convinced me that I should go back to medical school. But it was great advice. Like, I did love children, but now I love my own child, right? I don't need to be, pediatrics is about parents. I would hold off. You need to get through the first 2 basic science years of medical school. You'll do some clinical stuff, and you'll love the clinical stuff when you do it. You'll do interviewing, and you eat it up because it's so different than what you're studying. And the first 2 years are super important, but they're a base, right? Then you get into your 3rd year. I teach mostly 3rd year students. I love when they don't know what they're going to be. I love when they say, well, I want to go through each rotation with an open mind, because there's going to be so many variables. The person who's teaching you, who you see yourself in. One of my students sort of knew surgery, and I have some very close friends in the hospital who are surgeons, and we sort of talked about, well, what was it that she liked? Did she like the clinic part? Was she going to be, what the gender role, who goes into those things, what residency training is like. Outside of medicine, those things are really hard to pick apart. Once you get some experience, it's going to work out for you. I feel like the default is internal medicine, which is what I went into, because then you don't have to pick something. But like, if you know surgery, that's great. I have one student who just left me who knew he was going to be ER from, I think, the moment of birth. And he's totally has that personality, and I'm thrilled for him. And he actually hasn't even done his ER elective, because you have to do all your base, like surgery, medicine, pediatrics, OB. And, one day I was on vacation and I sent him to the ER to work with a friend and he loved it, so he totally knew. And I think it's going to be an amazing fit. What I try to tell my third year students now is be in what you're in now. Like, look ahead, make plans, but just having tunnel vision, you miss where you are in college. Like, I don't want you to miss college. There are so many things that you can do in college, like take a literature class or a language that you won't do once you go to medical school. It's if you go to medical school and residency and then you start practicing, many people have family, there becomes a whole different life balance. So don't forget that there are good things about each stage. And the funny thing is, medical education is so long. You get out, and for women, we're like, oh my God, we need to have children. We need to get married. Like, when is this going to happen? Like, I need to, and we get nervous that if you really just only look forward, you're missing so many beautiful things of the time. And I know it's hard, and I know it's easier, or everyone thinks, well, that's because you're in it, you're there. But it's my best advice. You should have a plan. You should, check your boxes, do your volunteer, figure out research, but also try to enjoy those things for what they are, because you may not have so many broad-based opportunities once you're in residency. Does not provide much time for training, for other things, for like hobbies and things like that. So.
Yeah, that's definitely true. And actually, one of the pieces of advice that Lana's brother gave us forever ago, he always said that he regrets not taking certain times off and enjoying some things, because now he's a doctor, full-on surgeon. Anyone that was on Dr. Jenish's session would know that he has a full life and 2 kids, and that's one of his regrets, is never like taking some time off and just enjoying and doing the traveling he wanted to do before all of that. So
absolutely. I went abroad in college. It was really important to me because I felt that if I was going to hit the path I was on as a doctor, it's really hard to change countries. And it's really hard to take time off once you're in an attending to keep your license. Certain things are sort of hard. And there may be times where you can slow down, right? I find that some of the students who've done just other things for 1 or 2 years just come back with a different understanding of how to pay bills, how to live on their own, how to do their laundry, and they're happy to be back. They're actually, and like I said, I took 10 years off, not on purpose. In fact, I was leaving medicine forever. But life is up and down. When you can, you gotta say, I need to do this now. So when I went abroad, I actually worked in a hospital in London, and I worked with a surgeon who was from Saudi Arabia, and he just took an interest in me. The place I did it through, I went through BU because they had an internship program. I actually put off my MCATs. So I should have taken them. I went abroad second semester junior year, so I took them in that summer. So I was a little delayed on my application, but I felt that that was worth it to me. I came home from being abroad, which was tough because we would go to Spain on weekends, like just crazy things, and studied hard, for my MCAT, and that I made it work. I actually got into medical school in my senior year of college, which was also sort of helpful because I had that honeymoon period of, okay, that's done. I don't have to worry about it. My school also did interviews and sort of put together this really nice package for your application. And so, if you're in college now and you want to take a gap year, that's a great idea, but just see if the resources sometimes that you have in an organization, and once you leave it, you don't have that same access.
Okay. Thank you for that. That was really awesome. I know a lot of people wanted to hear about that, so thank you. So we had some people just asking privately, when is the best time to have children for women, the whole process, because there's a lot of time And I know that the answer probably is it depends, but what do you think?
Yeah. So I guess I could say it like this: anytime's a good time, but no time's a good time. I really would say no time's a good time. And so the stuff I'd say about having children is you want to be emotionally prepared for it in whatever you're in. So I had people in my residency who had children in residency. I had gone back to residency, so my son was already in middle school. Um, there were people who were older and had children in medical school. I'm going to go through some of the pros and cons of all of those. So medical school is not a bad time because you take some time off. You actually have pretty good insurance. But you have to remember that when you finish medical school, you have to go into residency. And as your children are old, when you have a newborn, if you have someone taking care of your newborn, you can slip out of the house and sort of the newborn doesn't notice. But when you're a toddler at 2 or 3, it's like, mommy, and they're holding onto your leg, or you come home and they're already sleeping, there are a lot of feelings about that. I think the most important thing is a supportive partner, a really supportive network. My mom used to take my son when I did nights for weeks at a time. He would come home from middle school at like 3 o'clock, wake me up for an hour. My mom would pick him up. I'd sort of shower and go to work. If you're going to have multiple children, you have to think about that. Residency, I forget how it works, but as an attending, I don't have maternity leave now. You take paid time off. That's another thing to consider. When you interview for jobs, there's a consideration. They can't ask you what you are preparing to do, but a young married woman, they want to know how many maternity leaves are you planning on, because they have to work around that on your schedule. If you're a hospitalist, I think it's different. And certainly places have maternity leave. Just, I work, it's a little bit weird. Everyone's like, wait, you don't have maternity leave? Isn't that like a federal thing? I'm like, oh, no. But it's an important thing to ask. It's an important thing to plan. When you plan that, one of the pulmonologists, who's incredible, actually got asked the question, in her interview, you're a woman, why should we hire you? She's like, because I'm going to listen better. You need me clinically. And she's a rock star, by the way. But she went on maternity leave, and when she came back, the administration was trying to mess up her bonus pay. It's a weird system, but there's something called RVUs, and it goes by the time in the year. So if you miss your RVUs for the first quarter, you have to make them up in the second to get a bonus. She was out on maternity leave. So, you just need a plan. You need to know. And the problem is, I can't even tell you how many stories of people had a plan and then they couldn't get pregnant and they had to do IVF. I'm actually very happy to hear this, but Hafisa Khan had talked about miscarrying as she was on call in residency, sitting in the call room crying as she's bleeding. It's tough. You're in a stressful job. You're on your feet. 1 in 3 people will miscarry, and it's just hard to keep going on. But there's a different feel now. Certainly, I think people talk about that more. And secondary infertility, easy to get your first. When's your second going to be? I think Dr. Sinha is going to actually do one of your talks, but she talked about that too. It's important to talk to people, but there's no right. It's where your life is, where where your relationships are, and then you make it work. I think if you're looking for perfect, and let me tell you, kids are expensive. So, if you're looking for the perfect this, the perfect that, you're never gonna do any of this.
Thank you. Okay, so some of these next questions. So next question, what is one thing you wish you knew before applying and going into medical school?
I'm not sure. I'm not sure in medical school. I wish I knew. I think I wish I knew I could do it. I think I tell my students, I actually tell a lot of my patients who are in college looking to the future, have faith in yourself, have faith in your abilities. There's a lot of imposter syndrome, a lot, and it affects certain personalities a lot more than others. And you know what? The people who have imposter syndrome are a little bit more empathetic, right? Because they are worried that they are not going to do enough for your patients. There's something really humble and nice about it, but it messes you up. You know, you feel that every time you get a negative comment, they really see you and the other people don't. I could have 20 patients in a day. One said something negative. It's what I think about all night. You know, the 19 others are like thrilled, but you know, you just can't help it. So, you know, if this is your plan and you're doing it for the right reasons, and you have faith in yourself, have faith that this is right for you.
Yeah, thanks. That's awesome advice. Okay, so next question.
Oh, and let me just say,
yeah.
Not everyone's as smart as you think. You know, like no one talks about how dumb, you know, well, some people do. You know, there's always that guy who leaves the class and is like, I did terribly. I would you, blah, 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 blah. And then they, you know, they get top of the class. You know, there's always that guy. But you know, in anatomy class, when you start, even organic chemistry, or chemistry in Chem 207 in Cornell, I walked in, I pulled out my draw, it didn't click. Everything went flying to the ground, shattered everywhere. I walked to my brother's house after. I'm like, everyone's a genius. Why did you let me come here? Like, what is wrong with you? And I think each step of the way, I had that again in medical school. Oh my God, really? In residency. Oh my God, really? I mean, even when I was attending, I have to say the job I took, there was a mentor there. I had faith that he told me when he hired me, you don't know that much outpatient, so I'm here if you need me. And that was a great feeling. You know, I think if I was to name the toughest year, the first year as attending was pretty hard. I had a little different because I went back to residency later. So there was electronic medical records instead of writing in charts. So I thought the electronic medical record system would kill me. And every day at the end of my first month of residency, I walked out of Lincoln Hospital to get on the subway and I was like, good, I'm done and I'm never coming back. Like, I have finished today. I have done as much as I can, but I'm never coming back. And then at some point, you know, in the third month, I'm like, this is fine. I could do this. So, you know, can't help it.
Thank you. Okay, so yes. Okay, so can you talk about the differences between different primary care specialties, like internal medicine versus family medicine?
Yeah, so, you know, it just depends where you live, actually. So New York doesn't really have family medicine per se because everyone loves their pediatricians and they want to bring their kids to a pediatrician. So other parts of the country, and New York we're like the tertiary medicine capital of the world. I mean, I have some patients who have a doctor for every organ. I find it really weird, but you know, that's New York. And actually New York has one of the worst referrals to palliative care because of that. So other parts of the country certainly do differently. Most family medicine people today don't do OB because the malpractice is so expensive. So you just don't have that time. You don't have the ability to go deliver a baby and have a full clinic. I have this thing called traditional practice, which also is a little bit weird today, although out of New York, it's probably more, where I still admit my patients to the hospital. I looked out, you know, locally, and no one else really allows you to do that. They have hospitalists. I think it's bad for patients. I think it's more efficient and maybe financially good, although I'm not sure about the financial, because I love being in the hospital with all my specialists to say, oh, did you see this guy? What about this guy? I'm referring this person. I find the hospital a very good social ground and network. If I have a question about someone, I'm going to see them on Tuesday morning when I'm rounding. So I could be like, hey, or I have all their phone numbers. It's a little bit like keeping some part of residency still alive, because in my practice, we all practice in parallel. Like if I have a question, I could always ask, but in general, you're in and out of rooms, and you don't really do that. Academic medicine is clearly different. So that's family medicine and internal medicine. There's, of course, out of medicine, a ton of specialties, cardiology, endocrinology, rheumatology, and all those have fellowships after your 3 years of medicine. I mean, and then there's, you do a year of medicine and then neurology, or a year of medicine and ER, or sometimes those are all together.
Great, thank you so much. That's always such a confusing topic for everyone, so thank you for clarifying all that for us. So this one, it was a relatable one for me, but someone said that one of their fears is being criticized by professors or attendings for mistakes, or just asking dumb questions or whatever. So do you have any advice for not allowing that to not get to us, or trying to use it to better ourselves?
So if you don't ask, you're not going to know. I hear there are no dumb questions. It's a fine statement, but I think you're an idea. And by the way, when students don't ask questions, I think they're not interested. So I actually find it the other way when, so I mean, part of, I make fun of myself, but part of my job is being nosy. Nosy to my patients. I ask a lot of questions about drinking, sex. I ask my students that because I want to get to know what makes them tick. I want them, those kind of things. If you don't understand something and you let the opportunity of being with someone who can really explain it well to you go, then you've missed the opportunity. When I tell my mentors, you're paying for this education. You are going to be paying for this education for a long time if you are on loans. Like, use it now, because in residency, you may not have the time, the energy, or the people interested in doing it. So I would, and I'm telling you, people who want to teach you, who are interested in you, who will become your mentors, ask away. I don't think there's ever something that you shouldn't ask. I had one of my students ask me, "What do you think I should be, a neurosurgeon or a neurologist?" And I was like, "Huh?" I'm like, okay, that may not be a question for me. But we sat and talked about it. Like, they're totally different. Like, are you planning on being in the OR all day, or is that not interesting? But I was happy to engage with him. You may think it's a stupid question, but it may lead to a really good answer, or just a really good opening of them to give you resources and things like that. People who want you to do well, want you to do well, no matter what it takes.
Absolutely, that's good to know.
And by the way, someone in the group probably has the same exact question.
Yeah, for sure. It's always scary, but yeah, for sure, you're right. So moving on to, I guess, another authority figure-ish. A lot of people want to know, what is the best way to find a mentor, both in undergrad and in medical school, and especially right now when things are a little more difficult to find someone?
So I agree. Like I said, after my last talk, someone emailed me and said, "Hey, you going to be my mentor?" And I'm like, okay, so ask, like, when you find someone that you think is relatable and you can ask your dumb questions, that's going to be one of your people. It's sort of going to hit you when you're least looking for it, when you're like, oh, that though you have to ask, and people are going to say no because they have 1,000 things going on. They may be at their full quota and they just don't have the bandwidth. And that's actually it's not a rejection of you. You have to remember that. It's them setting boundaries for their self-care as well. But they may also be like, oh, I can't do it, but this person may be great for you. Again, If you don't ask, you're never going to get it. It's the same with jobs, raises, volunteering, like, go for it. But when people say no, get a little bit of thicker skin. It's not about you.
Yeah,
it may be about you every now and then, but usually it's not. Usually it's about them, about their commitments.
Yeah, absolutely. And, it all goes back to asking the question, and you'll never know. So just to kind of get a little bit more insight on this, because I know a lot of people have been wanting to know this answers, like, so what would be like the actual best approach when going for it? Like email, in person, I mean, there's less of an option right now, but like, what would be the best way of going about and asking? And then is there anything that you guys should establish for a good, mentor-mentee relationship? Because I know a lot of people have never heard of it.
Yeah, I think it depends what you want to get out of it. And I think you should be clear. If I were to approach someone now, I'd probably do it in an email. I'm not sure I'd do it in a text. I'm not sure. In person, sometimes the rejection stings or you're a little nervous to do it. But in email, introducing yourself, how you got to know of them, what you think is sort of interesting about them, and then what your goals are. You'd like to know a little bit more medicine. You'd like to have some shadowing. So Chloe asked if I would be her mentor, and I said, sure. We had a conversation, and then on Thursdays, I ran with my students virtually, right? So I FaceTime them, and she sat in on a couple of those interactions. And then what happened was the student said to her, hey, if she has any questions, she can email us, right? So, just being brave sometimes leads you down a road that's really good.
Perfect. Thank you so much for clarifying that. Everyone is loving this already.
But let me just say, I have to say, when people ask me for recommendations, it's a little bit different. So they ask me, and if I feel that I will give them a good recommendation, I do. But then I ask them to provide me with sort of the start of their personal statement and their CV. Again, because what I know about them is good, but I want to weave a little bit more, and I write my recommendations right after I have the students, so I remember. So that's also someone, if you can find someone who has a special interest, you may not want the top person in the field who's publishing and speaking at things. You want someone who's going to take ownership of you, or really be interested that you do well.
Yeah, that's for sure important to consider too. So I know a lot of people do think that they need to like a glowing a recommendation from someone very important, but that doesn't really lacks a lot of substance about them. You can tell it's not personal. Yeah.
I think it sort of goes along the lines of passion. When you're going to talk about a subject that you're passionate about, you just come off so differently. There's a twinkle in your eye. You want that person to keep talking. When I talk about my students who I think are amazing, I love them, it comes across, it's visceral, right? I know them well. I am going to talk about them well. And in all honesty, don't worry about your recommendations so much, because they're sort of negate themselves. Everyone gets 3 good ones. If I wasn't going to write a good one, I'm not going to write it for you. So not a lot comes out, pithy ones that aren't so deep, but again, those recommendations don't really make or break it, because everyone sort of is similar in that group. There are other differentiating features, but one of my students is, doing a rotation now. It was funny because she wanted to do it with a friend of mine. The school said no. She did it at another site, and one of the female residents is like, oh, I have papers I want to publish. Let's talk after today. It was a really busy day, right? So she didn't get what she wanted. She got something different. And then it worked out amazing anyway, because she got a female role model that she needed, who wanted her to do work with her, So, you sort of have to be open and then just keep looking, just be open to what's going to happen.
Yeah, for sure. That's awesome. So happy to hear about that. So thank you. There was a question kind of asking about how to make use of, gap year or years, and, beyond just shadowing that we don't get right now. Would, working in a lab or doing something a little bit more clinical based be better than, I don't know, just doing like a side project, or what would you recommend to help?
I think it has to match your interest. Like, again, stop looking for what they want. There is no like sure shot that you are getting in if you do these things. I actually wrote a really good blog about that. Like, I was checking boxes in my life, and at 30 I'm like, oh my God, right? Like I checked all those boxes. I was type A. I totally got to them and I was totally miserable, right? And it sort of talks about how I got back from that. So, we're not robots. Like, there's no perfect. So if you have an opportunity to work in the lab and that interests you, that's amazing. Like, this year you may have worked on some of the vaccine stuff, right? Like, Chloe, again, is volunteering, signing people in to do vaccines. Like, I think this social distancing shadowers, like, I think it's genius. I think it shows creativity. I think it shows a passion. I think it shows out of the box thinking. So if someone's going to go and take their gap year and even do post-bac, but do something like learn the ukulele, play the ukulele in a nursing home, and they, that meeting in the nursing home may be what you write your personal statement on. You just can't, like, again, what's good for you? What do you think? Like, I like that everyone asks me what I think, but I'm the same. I'm just on the other side of it. So, match what you think is, listen, if you're going to go to work in a lab and hate it, don't do it. Trust me, there are going to be enough things that you are going to hate in your life. You're going to be an adult. You're going to, take your kids to daycare and have a boss you don't like, or need to do this clinic that's horrible, or wound care, or carry the orthopedics box. Like, in your gap year, if you're doing post-bac and you have to do school, find something that is in school, for a minute. The other thing I'd really like to just comment on about just getting through this whole process is don't forget, you need to make a routine, you need to exercise, you need to eat well, and you need to sleep. And those habits are going to make you resilient. And this year has probably made you all resilient in some way. Resilience, actually, the blog I wrote is called Dissecting Resilience. I can get it to you, like a link if you want. But resilience is the key here. You're going to get rejections. You may not get into your perfect school. You may get into no schools. Once you go back and have a motivation that you are going to do this, I have more faith in those people than the geniuses who ace everything. Sometimes the things that don't go your way teach you a little bit more. But the point of this conversation was, start exercising now, start eating right, and sleep. Super, super important. I know you think if you just study a little bit more, you'll be okay. But don't forget, you make those memories when you walk away for a little while. If you sit for 6 hours and can study, that's amazing. But I want you to study for an hour and a half, have breakfast, study for another hour, 2 hours, go to the gym, right? Those are the times where you start to think about what you did in the previous time that you're real. And then if you're like, oh, I don't remember that, you'll just look it up again.
Yeah. As a psychology major, I can attest to that. That's the way to go. Have I listened to it? No, but it's definitely, the smarter thing to do. And especially as we all know, none of us get enough sleep. So
yeah. It's hard. I mean, it's hard.
Remember to get all those good habits now. Yeah.
The reason why is because the good habits are easier to make before you're under stress. When you're under stress, you need them more. but they need to be habits already to do them.
I think she might be.
Yeah, for sure. So still.
Oh, Yasmin, are you there? Okay.
Yeah, sorry. Am I good now? Okay. What was I gonna say? Okay. I was trying to find something someone had asked earlier. Let's see.
So one of
Yeah. Go for it.
so one of the next question is asking about finances and how to handle the cost of medical school and what it really, the truth behind finances entering into medical school in this path, and how loan forgiveness and so forth.
I wish I knew the answer. Like, it's going to change so much. I think there's legislation now. There was this lady named Sharon Says, I'm not sure if you know this, but she raised $500,000 to get some loan forgiveness. Even applying to medical school, taking your MCATs, all those post-bac classes, you have to figure that into your finances. And medicine is not what it once was. So, it's hard to tell you what it'll be like. I guess you should know the investment up front. You pay, if you have college loans, you're going to go further into debt on your med school loans. When I went to NYU, it wasn't free. My brother went to NYU medical school. It wasn't free. My parents are not so thrilled, but now it's free. I'm actually hoping more and more schools do that. But I actually wasn't so thrilled with the way NYU went, because many NYU students, at least when I was there, really do specialties, derm, plastic surgery. Many of my classmates have awesome things. But they don't need it as much. Like, I'd really like the money to go back into medicine in a way. But, primary care, oftentimes you donate, you give time back. You have to remember that maybe in a place that you don't want to live. You'll want to think about family and schools if you're going to think about those kind of things. It's hard. I don't know what to say. I feed my med students very well when I have them, because I feel like they need to.
Great. So thank you. Someone asked specifically, do you have any advice for approaching doctors for questions or mentorships when it seems like they're super busy and, they don't have time to even answer?
Yeah, they may not be your guy. If that's how you're feeling, even asking the question, you may want to think of somebody else. Approaching them at a more quiet time, emailing them, ask them if there's a good email for them. I actually don't use the one at my hospital system. I sort of check it once a month. I very rarely check it. Things like that. But again, the cream of the crop, that it's, people know that you're getting it for the name at the bottom, not the experience with you. Because, sometimes the best things people do isn't write a recommendation. This year I was so thrilled because I started teaching I started teaching a year or 2 years ago, but my first group was interviewing for residency, and I had some contacts. I'm like, oh, you're going there. Let me put you, she graduated from there, email her, find out, do this, do that. So that may be even better than a recommendation, so.
Yeah, for sure. Awesome. Thank you for that. You kind of did touch on this a little bit, but someone wanted to know, what are the things that we can do to be more competitive, in medical school, considering that we think we want to do a competitive residency or want to get into one?
Get as much experience as you can in that place. I think that's, I don't know. I'm not sure how else, That's it. I would get as much experience as you can in the field you want. But even if you're not, like, you know, some, excuse me, some people decide late that they're switching, right? But what made them switch was super important. And that story helps them, right? Like, you also sort of like that, you know, when it's not, well, I'm going to be an orthopedist and I did this rounding with this guy, right? And the guy comes in and he's like, well, I wasn't sure, you know, I really felt surgery was right. But then I saw this trauma and I followed this guy from, you know, the minute he came in to discharge. And, you know, I was blown away by this procedure, blah, blah, blah. And so after that, I went and I did X, whatever, you know, again, you know, remember the way you feel about it is super important because it motivates you to do different things, to, you know, and be creative. You know, what the guy did last year, like, as you know, it's an unusual time, right? Like, I love that you guys are problem solving to figure out what you need. The requirements will change, you know, everything will change, but the way you come across is so much about you.
Great, thank you so much for that answer. You have such a good way, everyone's already saying it right now, but you have such a good way of just like reassuring us and being super helpful and just like giving that really nice, realistic, like, you got this kind of so much already. Let's see, there was someone that had a good question. Okay, so is it true that the place that, or wherever you do your residency, is the place that you'll end up practicing, at least like the initially, if that's where you're gonna stop, or is that somewhere, you know, that you don't really have a choice in?
So I don't think that's true. I think, you know, listen, I think where you go to medical school, you know the way the place works, right? And if that's a good place, then you may want to stay for residency. And if you're like, this is not a good, you know, I don't like the way this does it, you're going to look for somewhere that does it a little bit differently. People move all the time. I'll say I got my New York license out of residency. Getting my New Jersey license, which like I'm like 1 mile away from New Jersey, took a year. So you may want to think about that. I strongly support people being near family. You know, it's hard to be a lone wolf. You'll hear it takes a village. Childcare is super expensive. If you have family members, in-laws, cousins, anyone who, you know, when you have time off, is there to pick you up off the floor, or, you know, I think my mom did my laundry for a couple of years. Like, that's amazing. So, you know, you're not locked in. Every decision can be changed. You know, people sometimes do a year in one residency and decide, oh my God, I want to be a pathologist. You know, and they change, you know, that happens, and that's okay. You don't have to figure it all out today.
Yeah, and I think that's really important. A lot of us forget that not everything has to be like planned out, just because that's what we feel like we've been told, you know, for so long, is that everything has like this is the right way to do everything, and it's the only way, and so it's
yeah, and there are definitely checkpoints. Like, I'm not saying throw out the script, like listen, you have to take certain basic science classes, right? I picked my major based on, it was going to be good to be pre-med with that. I was a nutrition major. Actually, it helps me in counseling all the time. I think my major was an amazing major, but I kind of wish I studied American studies so that, you know, I understood politics a little, you know, like just random, you know, like random things like that. You know, like, yes, you should get into med school. Once you get into med school, like, live that honeymoon, you know, like, enjoy, relax, travel a little bit if you can. You know, that honeymoon stage is an amazing stage. When you finish medical school and you're heading to residency, I took a Berlitz class to learn Spanish. I probably should have gone to Spain. You know, like, you have to remember that you're on a course that's really rigorous. When you can, take a breath, pick up a hobby, do something you've never wanted, you always wanted to do, but would have never done before because you were so busy getting to this place. Once you really start adulting, with, relationships and children and taxes and houses and mortgages and cars, you're like, wait, what happened? How did I get here? I mean, actually, I had a funny thing happen this year. I was talking to one of my med students and I said something my son had said. He goes, oh, I totally could have said that. And in that moment, he just aged me, because now I realized, oh my God, the med students don't see me as them. They see me as their mother. And I was like, oh, I reached a new milestone.
That's awesome though. It means that you're comforting. It's fine.
Actually, the funny part was the poor guy never even knew. But since I had him, I tell every student the story. I'm like, I get it.
Oh my gosh, people are dying. That's great. And it's really cute. Okay, so I guess maybe we could do like one more question, two more questions. We'll see. So someone wanted to know how we would know that we want to do or go about going into academics. Is that just kind of like your personal preference, going to academics?
Yeah,
and,
so
try
I
to
didn't
get
plan
out
on
as
it.
possible?
I actually was afraid that I had nothing to teach them and I wouldn't be a good enough teacher when I started. And I went to a place that wasn't academic. We got acquired by Westchester Medical Center, or New York Medical College, which is now under Toro. And it was the best thing ever. Someone was like, hey, do you want to teach? And I'm like, yeah, I could teach. And it has made my 2020 so much better. I worked inpatient during the pandemic, but coming out, like I get my job, like I could do my job. Now teaching other people makes that part so much better. It makes it so much more interesting, because I can't do anything about the system, the people above me, or even the people at my level. But listen, the people behind me better be empathetic, because they'll be caring for me. So, like I want them to get it. I want them, to really, really think and really enjoy what they do, and be good and kind. And remember that we're not you're not a diagnosis. You're a whole person with a family and a life. And, empathy is super, super important in our job, no matter what you go into in medicine.
That's very true and very important to consider.
Academics
kinda
has
goes
its
back to our
own
first question.
rigors also. I have to say, academics has its own rigors. I'm a clinical professor, so I don't have to publish. It's come to a point where I probably am going to. So I just got a text from one of my students. So they keep in touch and I love it. Once they're mine forever.
That's so cute. See, this will all need to go ahead and ask the question. So yeah, thank you so much. Let's do maybe like one more. I know this is how we end last time, but if there's one last piece of really awesome advice that you could give us, as hopefully, the things are going to start opening up, we can start going back into in-person experiences by the end of this year. Is there any last piece of advice you'd like to give us, especially for those of us going or applying the cycle?
Yep. So it's going to be twofold. One is the motherly advice is sleep, eat healthy, and exercise, because that's going to help you no matter what you do, whether you go into medicine or don't go into medicine. The other advice is you have an idea of what your perfect life is, and that never is going to happen. Like you literally haven't the thought, like I'm telling you, it's going to twist, it's going to turn, and that's the fun part, right? Like the goal isn't to get to be this person, because you just can't. Like pressures, changes, pandemics, a million things are going to get in your way. And just take a breath and have faith in yourself that you can do this. And sometimes you have to have faith that the decisions you make are okay. that you're going to change to do this, or you're not going to do it. Like one of the smartest people I know in college in her freshman year, we were same major. She's like, I don't want to go to med school. I was like, really? Like, I couldn't believe in her freshman year, first semester, she was ready to be like, no, I really don't want to do that. And she was right. She didn't want to do it. And that was awesome. I looked at her, I'm like, okay. I mean, I don't know if I was jealous because I really did want to do it. But knowing yourself and knowing what's right, you have to please one person, it's you. Pleasing everyone else, your parents, your professors, whoever's dying wish it was for you to be a doctor, they're not going to be there the whole time. You're going to wake up every day and put on your pants and have to do it. So, that core strength, that motivation really has to be so personal.
That was so wholesome. So many people right now are just saying that was what they needed to hear, and it was so important and incredible. So thank you so much again for being with us, and we always love having you. So we appreciate you giving all of these great stories and words of wisdom, and yeah, everyone just saying thank you right now. If you want to, or I can send you the chat later and you can see.
Look, I can't do two things at once. Wait.
I know, I was like, wait, I got you. Yeah, so I'll send you the chat. But yeah, so many people are just saying thank you. And honestly, you have a way of just calming us all down and making us feel so much better about